Big interview
with Bongani Bingwa.
On to this now. Hospitals are meant to be places of healing, aren't they? So why do they so often turn into places of harm? This year alone, nearly 7,400 patients were hurt in preventable ways, and that's an increase from last year. From bedsores to infections to falls and even, of course, self-harm when there isn't supervision. The worst hit, Chris Baragwanath has more than 1,200 cases. Then there's Dr. George Mukari, Steve Biko, Charlotte Bakleke, and Helen Joseph. Accountability, only 55 staff members faced discipline. 55. The Gauteng Health Department has had to pay claims of over 420 million rand. These are just for negligence. And while the department says it's reduced civil lawsuits from 18.4 billion rand to 12.3 billion rand, the real question is that progress or just paperwork? Far more worryingly, of course, when an incident like this, family members don't know what to do. The nurses or the staff who are often responsible generally tend to be dismissive. You're dealing with grief, you're dealing with pain, you don't know where to begin. Well, Johann Roux is a medical law attorney at JR Attorneys in Cape Town and joins us now to help us wade through this. Johann, a very good morning to you and welcome to 702 Breakfast. Thank you for your time.
Good morning, and thank you for having me on your show.
Over 7,000 patients harmed in Gauteng public hospitals for really issues that could have been preventable?
Yeah, it's quite a crisis that we've got in the country, and those figures are astonishing sometimes.
I mean, of course, Gauteng is where we are, so we'll focus on those. But I have been to hospitals even in the Eastern Cape. I'm thinking of places like Doranginza, for example. What does that say about our system in general?
I think we've got quite a problem with patient caseload, and that's, we've got, along with India, we've got the highest number of trauma cases in the world. And if you compare India's population is like 1.5 billion compared to our 60 million. So we've got a huge patient load. And you'll see that research would show that the doctor to patient ratio is usually your strongest indicator of negligence. The more number of patients you see per doctor, the higher the chances that there would be negligence.
I don't know if you've got the figure at hand, but for our public hospitals, what is the patient to doctor ratio?
No, I don't have the exact figure to hand, but it's, in research, it would definitely say that it's very high. It's amongst the highest in the world.
All right, so what kind of incidents are we talking about here then that patients suffer harm as a result of?
Well, if I could give you one of the examples from my own cases, it would be, a patient with an arm that the nurses are very worried about the arm. There's a problem with the blood supply, and they would start phoning the one doctor on duty from midnight, and he would eventually come and see the patient only at 7 o'clock in the morning, only to find out that by that time the arm is no longer salvageable. And no disciplinary action was taken against that doctor. I actually did make an inquiry about, 2 weeks ago. They said the doctor was still working there. And this happened like 2 years ago already. And that patient lost his arm. And the whole sequence was actually set in place with a drip that was not placed correctly. And it's things like that. It's so preventable. And
Sure.
you have to ask yourself, what happened? Why does it take a doctor 7 hours to see a patient who's in a dire emergency with nurses phoning him 4 or 5 times and begging him to come and see the patient?
All right, let's just go through that chain of events. So you're saying there wasn't anything inherently wrong necessarily with this patient's arm. The drip was placed incorrectly. So I suppose the first red flag for me is that the nurses themselves didn't pick it up, that the drip had been inserted incorrectly. Would that be fair?
That's correct. And in fact, this was a patient that went to hospital for mental health reasons. It wasn't even like
nothing to do with his arm.
Yeah.
So
correct.
As they escalate the matter, is it fair then, again, in the context of the ratios we were talking about, perhaps this was this doctor's first night of sleep. He you know that they often work very long hours, very long shifts. If the doctor can't get there immediately, I almost want to have some sympathy.
It is that, but I also get the sense that eventually, you stop caring, unfortunately. You just lose that human touch because you're so overburdened, That's the one worrying thing that I've picked up is that, they eventually you just stop caring. You've just got too many patients with too many problems. And if one has to lose an arm, the attitude seems to be, well, what can I do?
Sure. And often for families who are in these situations, they're horrified at the loss of a limb, but sometimes it's the loss of a life, right? And if then there's been some kind of negligence, they are solely reliant on the very people who cause that negligence to help explain in a compassionate way what went wrong. And often they're just dismissed.
Yeah, you're quite right. And one very ironic thing that I've found is many patients that contact me for advice would be that the first time that they heard about a possible claim would be when they're sitting in the waiting room for many hours and they start discussing their case with fellow patients, and the fellow patient would say, well, maybe you should go and see a lawyer about that. So it's them idly sitting around for hours. Eventually they hear something from another patient.
What's the worst case that's come across your desk?
I would say it's the death of a child also that's very preventable. A child that went in for a tonsillectomy, for example, and then started bleeding, and also it wasn't acted upon immediately, and then that child passed away. Tonsillectomy is such a common procedure, and to lose a child in those circumstances, I think that's the one that's hit me the hardest.
What was the explanation given?
There was bleeding that they didn't pick up, even though the blood test showed that there was bleeding, even though the child had all sorts of symptoms and showing that he's going into shock. And then also actually seeing the CCTV footage, which happened to exist, where you see the child walking with the dad and suddenly just collapses and passes away.
Gosh. What about the quality of nursing? Is that a challenge? Is that an issue?
Definitely. It's also part of the problem. A lot of cases come from nurses who don't place drips properly, and they don't follow doctor's orders. So it's very much part of the bigger problem also.
We mention public hospitals, but private hospitals aren't always great shakes either.
That's very true, and I think that is one misconception people have, is that it goes way better in private hospitals. It doesn't. In fact, this last case I mentioned to you about the child with the tonsillectomy, that actually happened in a private hospital.
Gosh, and how do they respond? Because I would imagine, again, if they're worried about litigation from patients and their families, that often means you're not going to get very much information out of them.
I think remember in the private hospital setting, the doctors are like independent contractors to the hospitals. So if a doctor gets sued, I don't know if the hospital would necessarily always even know what happens in the end there. But you do have cases, there are a few recent ones where the doctors then get their admitting privileges revoked by the private hospitals. So that's a sort of a disciplinary action that then gets taken. But they seem to be a bit more strict and more efficient with disciplinary processes against nursing staff.
But these accidents, this preventable harm still happens even in private hospitals, yeah?
Definitely, yes, it does.
So what do we do about it?
The one vacuum in South Africa, I think, is a lack of a proper regulatory process. A very efficient place where you can go lodge complaints and action gets taken. The HPCSA, unfortunately, seems to be inefficient in dealing with patient caseloads, the complaints that gets lodged, and that's definitely a big vacuum in South Africa.
I remember when I used to work for Carte Blanche, I can't tell you the number of doctor stories they exposed where people performed botched procedures and still no action was taken. Johann Roux, appreciate your time, medical law attorney at JR Attorneys in Cape Town. I think this is something worth highlighting because the numbers are simply staggering. Over 7,000 patients harmed in Gauteng public hospitals in only 1 year. That number doesn't include the private hospitals, and that number you also can say is arrived at because there's been some kind of acknowledgement that something did go wrong. How many others fall through the cracks?
Current events, developing stories,
tough questions.
your voice making a difference.
This is Breakfast with Bongani Bingwa.